So my name is Michael Palfreyman, and I'm the Chief Research and Development Officer at Cybin, and overall I'm responsible for the research from discovery right the way through to the early clinical evaluation. I've worked obviously for a number of years in different types of therapies. Most of the work is towards different types of mental illness, and one of the things that has always been very frustrating is that when you come up with a new drug, for the most part it's a small incremental change. But once we started working with psychedelics, you recognize this was a game changer. And then once you've seen some results that look very promising, you throw yourself into it to say, this is the one I'm going to really make work. Once Cybin came along, I said, sign me up. Well, I think it's true to say that nearly every family either has somebody in the family or themselves or friends they know. The number of people that are affected by mental illness is enormous, and it's impactful on so many different ways. So I think there are two really important areas where I think we can make a huge difference. One of them is obviously in depression, but particularly in what we call therapy resistant. And that's not just depression, but it's a lot of other mental illness. Really, the drugs we have really don't work very well. And then the other area where I believe strongly where there's going to be a real benefit is in substance use disorders. So things like alcohol, tobacco, potentially opiates as well. And that's going to be it's a huge problem for which there's very, very little benefit from existing drugs. So we need a breakthrough there. And again, the psychedelics already are telling us that that's a path to go down. So serious mental illness, including the addictive disorders. Well, initially people used the psychedelics like psilocybin in more religious ceremonies, and then they began to understand that there might be a potential to use them in a real therapeutic sense. And so the change has been quite dramatic in several ways. One is that we found that with the use of psilocybin, for example, 1 or 2 doses are sufficient, which is completely different from the way that you use, say, a Prozac or another drug for treating, say, depression, where you give it every day, probably for the rest of your life. So here's not quite a one and done, but a short treatment is changing the whole way that the response of the person is seen. And also it works very well in patients that don't respond to other drugs. So it's helping patients that have tried many things. And then lastly, the big game changer is that if you use it with the psychotherapy, the combination of a psychedelic drug with psychotherapy has changed completely the way we treat mental illness. So the combination of psychotherapy and psychedelics bring the benefits of both of those together and amplify each of them. So the very key unifying theme at Cybin, and all the people I think that work there are all dedicated to finding treatments for the patients. They're patients first sort of view. And then everybody brings their individual skills to help with that view. So if you're somebody in finance that's going to be raising capital, they're still looking to say, how can we apply that to benefit of the patient? And so that brings many people's different diversities and skills and everything together with a common mission.